more the moral injury, like not be like knowing what they want to do for patients and being prevented from doing it or having to do things that they don't want to do because insurance won't pay for it.
Hi, everybody. Welcome to Be Empowered, the podcast. This is a podcast where we dive into the realities of healthcare and entrepreneurship. We offer our opinion, unfiltered, unapologetic, and always with a dose of empowerment. We're here to amplify voices, yours and ours, challenge the status quo, and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Balakota.
I'm Dr. Shana Mokbam.
And today we have Kim Downey. She's a physical therapist and a 3-time cancer survivor. She's also a passionate advocate for physician well-being. She's the founder of Stand Up for Doctors. She has created a powerful platform dedicated to amplifying the voices of physicians, healthcare professionals, and patients navigating the challenges of modern medicine. Through storytelling, advocacy, podcasts, and community building, she shines a light on physical burnout, moral injury, and the importance of restoring the human connection at the heart of healthcare. So, Kim, thank you so much for joining us. Do you mind kind of starting off from the beginning, like sharing your journey in healthcare and what kind of landed you in physician advocacy?
Sure. Well, and thank you for this opportunity. I really appreciate it. And to briefly share, because I do have a YouTube channel and I tell my story in like 20 minutes to another doctor who was a patient of my radiologist. But basically, I'm a pediatric physical therapist by training, and I was working in a local elementary school. And I was diagnosed with thyroid cancer in the fall of 2020. And during the surgery, 3 of my parathyroids were inadvertently removed. And that caused a series of complications with calcium regulation and kidney function. So the next year was a struggle with some health challenges. And when I thought I'd be moving forward, I was diagnosed with breast cancer. So I had surgery and radiation for that. And then immediately afterwards, I was diagnosed with breast cancer on the other side. So I had more surgery and radiation. So it was really 2 years of constant medical issues. And I kept thinking, one more thing and I'll be done. One more thing and I'll get back to my regular life. And I had an amazing radiologist who I say performed a couple feats of miraculous technical skill on me, and that I realized the success of my first breast cancer surgery was equally because of the skill of the surgeon and the skill of my radiologist, and I appreciated that. So I was looking forward to seeing him for what I thought would finally be the first routine imaging visit after just having surgery, on both sides and all that radiation. And I showed up and he wasn't there. And I asked where he was, and they said he died a month ago. And I panicked. I said, "Are you joking?" And they said no. And I asked what happened, and they said they didn't know. And in that moment in my heart, I just knew that he had died by suicide. And I came to find out that was the case. And I fell apart. I couldn't stop crying. I couldn't stop shaking. My arms and legs went numb. And they found something else moderately suspicious for cancer that day. And I needed another biopsy. And I remember thinking, if she told me I only had a week left to live, I wouldn't be any more upset than I already was. So I've been well resourced in my life. I have loving family and friends, a good career, all of that. But by then, kind of hit bottom in my own brain. I was acting okay on the outside. I didn't know how to feel better. I took advantage of some resources at our local cancer support center. I didn't know what to do. Like, I read books, I tried art, piano lessons. And then I connected with Dr. Michael Hirsch, who became my physician coach, and he helped me process and accept a lot of things. Then I felt a calling to support doctors, and he connected me on LinkedIn in the spring of 2023 because I wanted to talk to doctors, thinking they could help me figure out how I could help my own doctors. But then I started connecting them, and that's how it all started.
So all of us have been patients, and you've been a patient. How did that experience as a patient shape the way to view this healthcare system and physicians?
Well, I'd say those are two separate things, right? How it's shaped how I feel about physicians now and how I feel about healthcare systems now. So, as far as physicians, through my most of my life until all of this happened, I was relatively healthy. And I did have an emergency appendectomy some years ago, but even then I didn't feel like a patient. It's like I had this thing happen, they took care of it, and I did go back to my regular life. So through all of this, and now I've become a chronic patient, it never ends. The tests and scans and just complicate issues from the complications. And so I need doctors where before I would have felt like if I wanted to go live in the jungle for like a few years, that's okay. Like I don't need doctors, right? But now without a thyroid or working parathyroids, I need doctors to keep me alive. So in that sense, I better appreciate them. But I also now recognize where I think before, when you just go for a routine visit, and you have to exchange pleasantries. They tell you you're fine, come back next year. I would always thank them. But it almost could have been almost like visiting like a kind friend at the post office or in the grocery store. It felt a little more maybe transactional, like you do this for me, I thank you, and I pay you. But now I've developed like relationships with my doctors, and just that connection means everything. And just through hearing stories, through individual doctors or my own doctors, like now I know all of it. And it's like any problem you have, your doctor, one doctor has it too, right? So I've just realized like the humanity of doctors, so I have a much deeper appreciation. And in my own episode, introductory episode, I had told the other doctor that like I wasn't walking around thinking about doctors any more than you're walking around thinking about physical therapists, like until you need one. And she said that's true because she was going through physical therapy. So she was then grateful to physical therapists in a way that she hadn't been, as she's busy practicing as a doctor.
Yes, I mean, it's really refreshing, first of all, to hear you talk favorably about physicians as a patient. And I think partially because you also are part of the healthcare system. I think in many situations, unfortunately, when you look at social media, it's physicians are villainized to a certain degree, as if we're also not navigating this healthcare system, right? I mean, we're also patients. So I think definitely, I mean, my view of the healthcare system has changed being in it. How about yourself?
Because when I was a healthcare professional, and it did form a barrier between the patient and the clinician, being myself, in that before, like when you were going to do even an evaluation, you would know what you wanted to write down about the patient, and you would make it as succinct as you could to get the information you needed to treat the patient. Well, with the EMR, you have to click so many boxes and everything, is that it was so time consuming that, and then even the daily updates and all of that, that you did have less time to spend with the patient because you had the responsibility to fill out all of these metrics and all of those things. So I had deeply experienced the frustration first as a healthcare professional, and then being in the system. Then now when you go to the doctor, and so many times they're sitting in front of the computer, and I totally understood it. But some doctors don't. But then I worry about them even more because then they spend hours at night, like writing. So it just feels like there's no good solution. So so the so it is the healthcare system, but then it's the expectations of them too. So it's the insurance, like it's all of the things, the prior authorizations and all of the things.
Yeah, I mean, a lot of these processes have taken some parts of the humanity, I feel, out of some of the physicians, not all. And a lot of physicians are really exhausted from this administrative burden. You talked about humanity behind the white coat. Why do you think that humanity has become so overlooked in medicine today?
Well, I feel like some of it, now that I've learned so much and talked to so many doctors, I feel like some of it starts with I feel like the culture of medicine has to change, and it has to start in med school, because the things in med school and residency that doctors are trained, like they're trained not to really show emotion, not to be vulnerable, put your head down and just keep going, dissociate yourself from the patient. So some doctors have realized that they internalize that, but that they got it all wrong. And in one doctor, in one of the books that we've collaborated on, wrote that you have to find your way back to and that really that's what makes it worthwhile is that physician connection, relationship, and all of those things.
I agree. A lot of our training, like the focus isn't on empathy and humanity. It's more on like who can score the highest on our tests, right? On our shelves, on our boards. And actually, I think it's almost discouraged to show feelings. Like, especially through training, I felt there just wasn't a lot. Well, there wasn't a lot of time, first of all, but also, like, who are you going to process it with? You you can't. So either you go home with it and you try to process it on your own, or you just don't. And you're expected to do X, Y, and Z, maybe run a code, see multiple people die in one day, and then you just move on. It definitely is not healthy. It doesn't encourage or award a well like regulated physician in that sense, because I think a lot of us suppress our feelings, because we kind of have to, because I mean, what other choice is there, unfortunately? And I agree with you that I think that system needs to change as well. What inspired you to create Stand Up for Doctors?
So I didn't have a plan to do this. It just kind of evolved. So once I started talking to doctors and I wanted ideas from them as how I could help the doctors in my own local healthcare system. And they would say things like, I think you're meant to make a bigger impact. You can make a bigger impact outside the system. And I was like, I don't care about that. I have no grand aspirations. I just want to help my own doctors. But when I would talk to them, I would be like, oh, like you would like to talk to this person or you would like to talk to that person. And it organically happened that I started connecting doctors with each other, and then they'd have conversations, driving to work. And then by that fall of 2023, I started the podcast, and the name came to me, Stand Up for Doctors, and the four is in parentheses because when I'm interviewing doctors, I'm saying, stand up, doctors, raise your voice. We need to hear your stories. And when I'm interviewing other people, I'm getting the message across to them why we need to stand up for doctors. And then that evolved into then I was sending my own doctors monthly updates so they know they had a patient trying to help them, and that turned into a Substack newsletter. And then a year ago, January, we reached out to the first 15 guests of my podcast, and we wrote this book together, White Coats, Human Hearts, and it's 15 physician stories. And Kevin MD writes the endorsement on the back. So I was so proud of this. And there's many more stories to tell. So a few months ago, we came out with the second book in the series, which is White Coats, Human Hearts. And what I love about this one is that we also add the voices. I've also interviewed physician spouses and patients. So we add those voices as well. And then I'm planning a physician retreat for this fall. So stand up for doctors. I didn't plan on doing any of it, and it continues to evolve.
That's really amazing. And going back to the point where, the training, what we learned in training, how to have bedside manners or sit down and talk to the patient while, and not stand, talk to the patient. But the problem is a lot of these are not applicable in a healthcare system that's requiring you to spend 5 minutes with the patient. And then the rest of the time, the 30 minutes is you're doing administrative work. So it's not that they don't teach you, but it's not practical because in real life you can't even use those skills. And then you graduate and you go to attending life, and you're in a system where they want you to just put codes in, and they just want you to spend a few minutes with the patient and move on to the next patient and move on to the next patient and move on to the next patient. I mean, it's so true that the humanity part of it is where you can connect to your patient, and that's where most of us went to medicine for. The days that I can spend time and talk with my patients about what they're doing that day, what they're doing for the summer or their vacation time or things like that, those days are so much more fulfilling for me than the days that I don't have time to talk. So it's so true that all of us are struggling, in this healthcare system. So But recently, physicians have started talking about, burnout and moral injury. Now it's kind of increasingly acceptable, maybe because of the suicide rate. I mean, the suicide rate is extremely high within physicians, and so this they were suffering in silence for all these years. Now it's there is a little bit more public attention towards this. From your perspective, what are the biggest drivers behind, this crisis of the moral injury and burnout?
What it keeps coming back to is loss of autonomy and loss of control, which is both real and perceived. There's been a lot of loss of autonomy. However, when many doctors receive like coaching or therapy or things like that, you simultaneously have more control than you think you do about certain things. And one example I've been sharing related to that is my physician, Michael Hirsch, is a GI doctor. And he shares a great example where in his training, he was taught that on procedure days, you're supposed to do colonoscopies from like 7 in the morning to 5:30 at night, and you don't take a break. Well, he would get really hungry in the afternoon. He would get really tired in the afternoon, and everyone else on the team got a break for lunch except him. So he asked for a lunch break, and they were told no, that'll disrupt the schedule, and they gave him a lot of reasons, and he got a lot of pushback, but he didn't give up. So eventually he got a 30-minute lunch break. Now, if he wants, he can eat a sandwich, right? He can take a deep breath. He can go to the bathroom. And then once he did that, then some of his colleagues asked for a lunch break too. So now some of them get a lunch break as well. So I feel like if you what he would say too is if you don't think you have control over something, you can ask yourself, like, is that true? Is that really true? What if the opposite is also true? And he also says sometimes you can't read the label from inside the jar. So sometimes, even if you are a coach or a physician coach, you need to check that with someone else, and they might give you ideas to think outside the box. Or maybe you think you have to work full time, but it might be possible for you to rearrange your schedule if you want to get to your kid's soccer game on a Friday at 3 o'clock. And you might think, oh no, that would never fly. But if you don't give up or if you think creatively, uh, you do have a little more control than you think. But that's not to discount the absolute loss of autonomy that, I mean, I felt as a physical therapist over the years. I graduated back in 1988, and things are very different now, right?
I think it's kind of ridiculous that being a physician used to be this very like noble career, and it still is. You know, you're a patient, I'm a patient. I think very highly of my physicians. We're very skilled and we're very necessary. But we went from a place where we were pretty revered to now begging for a lunch break.
Yeah.
It's so ridiculous. And like even if they give it to you, I bet you they're not paying for that lunch break. It's probably an unpaid lunch hour because that's what they do nowadays. You're expected to work like a robot, similar to what Shala said. You just have to keep going like a little cog in the wheel. And please, can I get a lunch break? Can I get a physician's lounge? Um,
Right.
Gosh, I mean, I'm sure things have changed a lot since the 80s. I mean, in fact, I know we've spoken to some of the older doctors who say they are. I understand the point of, trying to take back some of the autonomy. I like that your advocacy group is stand up physicians because I think a lot of the times we need to be reminded that we have to use our spine that we have and stand up because a lot of us don't. And I think
Right.
a big part of that is because they tell us we have to be altruistic, like we have to do this for the patient. Well, I can go to the bathroom, eat something, and also still take care of the patient, so yeah, I mean, there's a lot going on there. And it sounds like you interviewed a lot of physicians as well throughout different specialties and healthcare workers overall in writing your books. What like common themes or emotions keep coming up in these types of conversations?
Well, some of the things actually that we've already talked about, that the loss of autonomy, the doctors, the decisions they used to make, they were in private practice, but then they were kind of forced to join up with healthcare systems because the overhead. became too much, or just like the rules and regulations and all the insurance, like they'd have to hire staff to do that. So they became, part of bigger organizations, and that's some of how they lost their autonomy. So that is really a big one that keeps coming up, and you guys have already mentioned exhaustion. That's another big one. So frustration, and also like, more the moral injury, like not be like knowing what they want to do for patients and being prevented from doing it, or having to do things that they don't want to do because insurance won't pay for it, or and things along those lines.
Pause here for this week, but don't go too far. We'll be back for part 2 next week, and we'll tune into the rest of the conversation. Thank you.